Everything about pregnancy, from A to Z. Only on howtogetpregnant.net.
Having trouble getting pregnant is not unusual. In fact, it affects about 15% of couples in the United States, and the reasons for this are quite varied. About 7% of the time it's attributable to causes from the male. About 37% of the time it's the female where the problem lies, and about 35% of the time it's a combination of the two. That leaves a fair percentage of cases that are really just baffling to physicians, where we can't really come up with a clear idea or explanation of why a couple can't get pregnant. And infertility, as we define it, is 1 year of unprotected intercourse without a successful pregnancy. And so the issues can be multifactorial, and just talking about some of the female issues, being overweight or underweight can have a significant impact on the ability to get pregnant. For example, we know that the patients who are significantly underweight, 17 on the body mass index scale or less, have often greater difficulty getting pregnant. They're more prone to amenorrhea, which is lack of a menstrual cycle, and if a person's not ovulating, they're not going to be able to get pregnant. A simple solution is to cut back on exercise and try and gain a little weight. The more challenging issue arises with patients who have eating disorders. Obviously, trying to solve the eating disorder is paramount to success, but when that fails to result in pregnancy, there are some other options such as pulse hormone therapy. All this can be provided by specialists in OBGYN or infertility specialists as well. On the other side of the coin is patients who are obese. Patients with body mass indexes of 27 or greater oftentimes have menstrual irregularities, and oftentimes this stems from hormonal issues. Patients in this category often suffer from polycystic ovarian disease or syndrome, and physicians know that by losing as little as 5% of the total body weight can improve the odds of getting pregnant and increase the likelihood of ovulation. And so that's just one factor to keep into consideration. Tying that together, at least the obesity side of things, or underweight as well, is hormone abnormalities, particularly thyroid. And so that's one of the things that physicians will often assess is a TSH, which is a thyroid stimulating hormone. And so if there's difficulty getting pregnant, that's one of the hormones that can be measured. Some of the other ones are FSH and LH, and it's interesting to note that there are some home tests that can be run on the urine, and so this may help people predict whether they're ovulating or whether there could be a problem with the ovaries themselves releasing the eggs. And so that's one aspect to consider. Another thing to point out is that it may not be hormonal. It certainly could be structural. And by that I mean there could be a problem within the uterus, in the tubes connecting the ovaries to the uterus, or the ovaries themselves. And this is another area that can be further evaluated if a couple's having trouble getting pregnant. And so some of the tests to use to sort out this would be an ultrasound, which is a non-invasive test to look at the structures. For example, if there's a fibroid, which is just a muscular tumor or growth inside the uterus, this may prevent the egg from implanting or sticking to the inside lining of the uterus. And so your OBGYN physician or family practice physician may order an ultrasound to assess for that potential complication. It's also a great way to look for cysts on the ovaries. Another potential area of problem would be scarring inside the fallopian tubes. These connect the ovaries to the uterus, and so if there's scarring in these tubes for a variety of reasons, such as infections or other surgeries or other processes, this will impede the ability for the egg to get inside the uterus, or for the sperm to even get up into the fallopian tube. Obviously, we don't like the egg to be stuck in the tube, because that would be an ectopic pregnancy, or a pregnancy in the wrong spot. But scarring in these tubes, which prevents the egg from getting into the uterus, is going to impede pregnancy. And so the physician may decide to order a test called a histosalpingogram. Basically what this is, it's a dye study where they use some dye and squirt it through the cervix, which is the lower part of the uterus, the opening to the uterus, if you will, and see whether this dye makes it all the way up inside the fallopian tubes. If it doesn't, there's a problem along the course of that where there's some scar tissue or blockage. And so that's another aspect that can be further evaluated. Occasionally there's problems with the cervix itself, We know that at times there's problems with the mucus of the cervix, which may impede the ability for sperm to even enter into the uterus, or perhaps there's incompetence of the cervix. The cervix, you can think of it as basically a muscular opening that's holding everything inside the uterus, and so as a pregnancy progresses, the cervix, if it's incompetent, may open or dilate and allow the products of conception to pass through the cervix and cause a miscarriage. And so that's another aspect to consider. And also the timing. Most people probably have some understanding that ovulation occurs roughly day 14 of the menstrual cycle. The problem lies in if your cycles are irregular, if you have some spotting in the mid part of your cycle. These are not uncommon problems, and it can make it a little challenging to determine the exact time of ovulation. And so there are some further tests that could be done. Blood testing for hormone levels is the most accurate. There are some over-the-counter urine methods that I mentioned earlier, but obviously that requires some interpretation, but fortunately the instructions are right there with these take-home urine tests as well. And so those are just some of the female factors to consider. Male factors obviously are mostly related to sperm or sperm motility, and this can be evaluated in a number of ways. A semen analysis to measure the number of sperm and determine whether they're motile or they're swimming adequately, or if there's a problem with the actual direction of the semen and sperm. Sometimes there's an anatomic problem where the semen and sperm go backwards into the bladder instead of out through the penis. And so those are all things that can be explored further if a couple's having problems getting pregnant.